Hi, welcome to BariNation, where we support the bariatric community with humor, humility, and honesty.
You've just tuned into a podcast that welcomes you into a community, a resource center, and a safe place that powers your journey towards personal wellness.
Our goal is you leave us today feeling hopeful, inspired, and ready to live your best bariatric life.
This episode of the BariNation podcast has been brought to you by Advent Health Central Florida. They are on a mission to help their patients connect their mind, body, and spirit, ensuring they can live their best, healthiest life. And because we partnered with them, their patients get access to a special monthly discounted BariNation membership rate. Reach out to your provider today so that you can access this amazing opportunity. Thank you again to Advent Health Central Florida for their support of BariNation and patients everywhere. Hello, everybody. Welcome to the BariNation podcast. Today, we are thrilled to be welcoming an expert that we have not had the pleasure of interviewing yet on a topic that is near and dear to our hearts here at BariNation. Dr. Melissa Bagloo from Advent Health Central Florida is joining us today to talk about revisions. Hi, Dr. Bagloo.
Hi, thank you. Thank you so much for having me. I'm very, very excited to be here. And, this is a topic that I think is really important because it doesn't get addressed quite the same way and sometimes carries a stigma with it. So I'm glad that we get to talk about it and we get to, delve into it and really address why it happens because it's actually very common. And so I've had a lot of experience with this. I've been practicing for over 10 years. And so I've seen a lot of patients and I just want to make sure that when people walk away from this, you realize that, this is a disease process and having a revision is kind of part of that.
We are so thankful that you started us off by saying that. It is something that patients, I think, carry a lot of shame and stigma around. And really our main goal of this conversation is that we understand that obesity is a lifelong and chronic disease. And sometimes our disease progresses in a way that makes a revision necessary and needed. And we have two patient experts joining us today as well, our very own Jason and Natalie. Natalie has had 2 revisional bariatric surgeries. Jason has had 1. They have really been through it all when it comes to revisional surgeries. And they are going to share with us not only the big why behind their revisional stories, but some very poignant moments about when they knew revisions could be possible and how they themselves have also worked really hard to shed that shame and stigma that many can feel around revisional surgeries. So if you are pre-op watching and listening, or if you are post-op watching and listening, this episode is not only going to help you better understand just what the disease of obesity is all about, but how it can progress in our lives, how it can look different than what we thought it would when we had our initial bariatric surgery, and what we can do if a secondary revisional surgery is necessary and needed. So if you guys are good with it, I say, let's just dive in. So the first question that we want to start with is, Dr. Bagloo, what is a revisional bariatric surgery?
A revision can be any reason why a patient who's had a prior operation needs to have a second operation related to that, right? And there could be a number of reasons why that needs to happen. Some of it could be, a complication perhaps, right? Hopefully not, but a possibility. Some of it could be related to weight regain. And some of it could be that perhaps the initial operation you had wasn't just quite the right fit. And so we need to do something else in addition to that. And so I think those details are really important when we kind of go through this.
I noticed I was one of the people at my age and my size when I had my original sleeve surgery. I was 44 years old and weighed 470 pounds. And I was told by my surgeon automatically I was too high risk to have anything but the sleeve. And that I would need an additional revision later once we got enough weight off me that I felt like they felt I was in the safe category to do it again. And in my own foolish man mind, I was like, no, I can do this. I don't need a second surgery. I'm going to be the exception to this rule. Like, this is just how it's going to be. And, we'll get into that later. But yeah, I just assumed I was going to be the exception to the rule. And I was wrong.
Yeah. And I know for myself, it was twofold, as April said. So I had the lap band in 2009. I was 350 pounds at age 15. So I needed the assistance, kind of battling that disease of obesity. But I unfortunately did experience complications, and they were severe enough to where they had to remove the lap band, allow me to heal. And then about 18 months later, after the removal, they revised me to plication surgery, which I'm sure Dr. Bagloo, you may have heard of. They don't really do it anymore for anyone listening. It's not really in practice, so I've heard. But I had that done. 10 years later, I gained all my weight back and then some, never felt restriction, and pursued VSG. And I came to find out that, again, I had complications with my plication where 2/3 of my sutures had come undone. So both of mine, unfortunately, were complications of the surgery. But yeah, third time's the charm, I guess.
Yeah, I mean, I think that's an important point that you bring up, is especially patients who've had the band. A lot of them have needed revisions.
And I just want to give 2 shout outs. One, we have so many members in the BariNation support community who are in the process of going through revisional surgery or are on the other side of it. And just from my friendship with Jason and Natalie, I know how long it takes people to make the decision to have that procedure. There's a lot of guilt. There's a lot of shame. There's a lot of second guessing. And to have that safe place where people can go and talk about their fears and what they're worried about and what they're kind of living through can be really important. Because Jason, and this is my shout out to you, I appreciate you saying you went into your first surgery saying, we've got 4 years of podcasts or 3 years of podcasts of you saying, I absolutely am never having a second revisional surgery. And Natalie and I and our community witnessed you struggle for about a year with weight reoccurrence, with your return of your comorbidities. And even though we are so close, we are very close friends, we thought we were saying all of the right things to you and you were hearing us, but you weren't really, I guess, hearing it or internalizing it. And we know that that's not because you don't care about us and you don't value what we say. It's because the disease of obesity really prevented our words and like worry to reach you. And it was a singular conversation that turned you around, and we're going to get into that. But I just want to kind of, I guess, acknowledge the work that so many patients have to do after surgery, because revisions might be something that they need to go through. And it's almost like starting the process all over again from scratch. So Dr. Bagloo, when you hear Jason and Natalie talk about their own revisional stories, are you also hearing your patient stories reflected in what they're saying as well?
Absolutely. I mean, so Jason, your story about that 2-stage approach, I have that conversation with a lot of my patients. You know, the sleeve was created as the first stage, you know, of a duodenal switch. So when patients were too high risk and we said, you know, the bypass may not get you what you need, you really need a duodenal switch, but you're too high risk. It's going to take too long. The operative time is going to be at risk, or your medical problems are going to put you at greater risk. So we want to get you on and off the OR table, help you lose a substantial amount of weight, knowing that we're going to come back and do that second stage later. But by doing it this way, we're going to decrease your operative risk. That's a conversation I've had over and over and over again with my patients, because it's important. And the goal of what we're doing, right? This is not the easy way out. And anyone who has gone through this process knows that, right? But what we're trying to do is have you go through this process, do it safely, get the weight off and keep it off, right? Knowing that every chronic medical problem that we have, right? Think about it, hypertension, heart disease, diabetes, you know, they're progressive. Obesity is no different. Right. And so it's a progressive disease that we're trying to treat. Right. And then, Natalie, to your point, you had the band, you were 15 when you had that done. So we weren't doing sleeves and bypasses in all patients that were adolescents. And so when I initially started practice, I was up in New York and at an academic program. And that's exactly what we were doing. We were doing bands for adolescents and seeing that, you know what, the results aren't what we had wanted, right? And that's when we started transitioning into doing then sleeves for adolescents, right? But again, we weren't giving the full options to adolescents. We're still learning about that. And so, these conversations are very common. And what I want patients to know is that it's okay. And just like it was a very personal and difficult decision the first time around, revision is no different.
What popped into my head when you were talking, Dr. Bagloo, was you have those conversations all the time with your patients. Jason had that similar conversation with his surgeon. Mm-hmm. Jason, do you remember when you had that first appointment with your surgeon and he told you you're going to need a second surgery? Do you remember, and this is like a totally off the cuff question, but I'm really curious now. Do you remember what you heard? Not what he told you, but when he said you're going to have a second surgery, was it almost like a challenge for you? Like, were you hearing, he doesn't think I'm going to be able to do this. He thinks I'm going to need more than this. So you almost took it as I'm going to show you kind of conversation.
100%. That's why I say in my man mind, because that's what I heard, challenge accepted, that whole joke. Like that's exactly what I did. And it wasn't so much brought to me in the way what he said. He just, he explained that I was high risk. He explained why, but his only other option, he was a chicken or fish guy. He was a sleeve bypass the end. There was no other exploration of it all. So when he said that, it was kind of twofold for me. One, I was like, I'm going to do this and I'm not going to need your second surgery. That's cute, but that's not going to be for me. The second is I looked into it for myself and realized I was not a good candidate for bypass in the beginning or the end. So I knew that the second if there was to be a second stage, I didn't want it to be that. So I really tried to put my all into making the sleeve work. So not only did I kind of do myself a disservice, instead of, I kind of researched as to why the one is bad for me without realizing that there are other opportunities that wouldn't be bad for me. Mm-hmm. So I fell short that way, but I also feel like not only did I do myself a disservice, but I created kind of the stigma that I fought through for not only myself, but for other people. Because like April said, I was on the podcast blowing my lungs out, talking about how I would never, not me, I will never. And I legitimately, out of 200 episodes, there's probably about 90 of them where I said that very thing. And so I feel like not only did I make it harder on myself, but I made it harder for other people to finally come and kind of realize the same thing, which, we'll like I said, we'll get into a little bit later as well, because, when I finally came to the light about it, it was a completely different conversation. Then, much like the sleeve surgery, I wanted to shout it from the rooftops and let everybody know what was going on, what was about to happen, that the changes coming. And I was so excited about it. It just breathed a new hope into me that I didn't have at the time.
What I also appreciate about this conversation is Dr. Bagloo is recognizing that, like most things in life, technology advances and continues to change. And if you had your bariatric surgery just a few years ago, the technology, the tools, the insights, the research that has been done means that you have very different treatment options that are available to you today than you did when you had your initial procedure. So it is so important to continue your follow-up care with your bariatric surgeon and to continue to be honest about the things that you are experiencing as a patient, right? Because if I'm not being truthful with my provider doesn't know the full story and can't have a holistic conversation with me about my disease progression.
Yeah, I mean, that's spot on, right? So I always tell my patients, I am never going to be mad at you if you are struggling, if you are gaining weight, right? That's not what this relationship is supposed to be, right? I'm supposed to be here as a resource for you to help you, especially when you're struggling. That's the whole reason you need a physician, right? And so I want patients who are struggling to come back, because if we can catch it early, then maybe we don't need a revision. Maybe there's something we can do to halt that process, right? But if it progresses and we don't address it and it continues to get worse and worse and worse, then we may not be left with any other options other than surgery. And again, it's, a lot of people look at this, oh, it's a failure. I failed the operation, or the operation failed me. I've heard patients say it both ways. The most important thing to know is that there's no such thing as failure. This is a journey. This is a treatment of a chronic medical problem, and there are going to be ups and downs, right? And one of the things I try to tell my patients to think about obesity is if you had a slow growing cancer, you would treat it, right? And you would continue treating it so that you could keep it at bay. Now, obesity isn't a cancer, thankfully, right? But it is a chronic problem, right? That's going to affect quality and quantity of life. So the gist of it is the same. So you're going to treat it lifelong, right? Until they come up with that magic cure, right? And even surgery, it's a tool. I never tell my patients it's a cure, right? So until they come up with that, then we have to work as a team to take care of you. And if you feel that your doctor isn't there for you and isn't going to take care of you or is going to be mad at you, then that might not be the right fit.
I was going to say, I appreciate that more than you know, Dr. Bagloo. And I know our listeners and BariNation members would echo the sentiment. I just, to your point, April, of the advancements that we're seeing. I mean, my first surgery was in 2009. We're 15 years later. The way we speak about obesity, the way we treat obesity, the research being done and education being done about obesity is so vastly different than it was in 2009. And I think that's the beauty of this conversation is if you're feeling like you need to change something or something's got to give or, you know, you're feeling lost, I hope that this conversation guides you to do your research and see what options are out there. I know we'll get into more about how to know when revision is needed. But I just hearing you speak, Dr. Bagloo, about how to talk to your provider is enormous. It's a huge change from where we were 15 years ago. And that's the point, is to continue to go to your providers, continue to learn because they're learning just as we are, which is incredible.
Yeah, I mean, there are procedures we do today that are much more commonplace than they were even 5 years ago, right? So the SADI, for example, that wasn't being done that commonly. And now we see it being performed more and more. So, more and more information comes out. We get longer term data. We get information that we can then use, right, to standardize these procedures and get coverage for it from insurance. So this is an ongoing process. And that's kind of the history of bariatrics. It's never been stagnant. It's always ever changing. So that's something that I think is an important point, is that we're still learning about obesity. We have not figured it out, right? And I don't see that happening in the next 5 to 10 years, right? So it is going to be continually growing. And it's one of the things I like about this field because it continues to challenge all of us, patients and physicians, right? For how do we best address this problem?
Well, the next thing we'd like to know, Dr. Bagloo, can any initial bariatric surgery be revised?
So it depends on what's going on. So let's use the band as an example, right? So, when I first started practice, the band was very, very popular. We were doing it all of the time. And then we learned, well, maybe it didn't stand the test of time. Maybe it didn't do what we wanted it to do. So I have removed bands and converted patients to sleeves or bypasses, right? So that's a very commonly done procedure. If you have a sleeve, patients who develop reflux as a side effect of it, we convert them to bypasses because it'll address the reflux and it'll add some weight loss. So it's not always that we're doing a revision purely for weight loss. It may be because of something going on with the original operation, right? Or if your sleeve was done as that first stage approach, right, that could be converted to a bypass, a SADI, or a duodenal switch. So you have options there. I think the toughest one to do the conversion for is a gastric bypass because, for that, the data is a little bit more mixed in terms of what we're able to do. But even then, you can do limb lengthening procedures where we make it more malabsorptive. So you're absorbing less of those calories. So it goes more towards a duodenal switch or a SADI. We can, depending on if there's a complication. So sometimes that pouch can reconnect to the gastric remnant, the area that we separated, right? And that can lead to ulcers, weight regain, lots of things. And so sometimes we have to go and revise that to prevent that from happening, right? And reset things essentially. So there's always options for what can be done for any of the operations. You just have to kind of look at the whole picture, see what the underlying issue is, right? I don't think that every patient that comes through the door has to get a revision if they're having issues. I think you as the physician have to sit and really evaluate, well, what's the underlying cause and how do I intervene to best help that patient?
Yeah. And I very much appreciate you calling out revision is not just about weight loss, right? It is about so many other things. And again, it goes back to this relationship that you develop with yourself and your bariatric care team. Everybody's situation truly can be different. And if you are not having kind of those brave conversations with the people that you trust or with the people that you are getting to know, you're missing part of the picture. So it's important to know that revisional surgery is not just about losing more weight. Revisional surgery is about your overall health. It's about chronic disease. It's about comorbidities. It's about new things that could occur or appear in your life after surgery. It's important to keep those conversations going. And I just know oftentimes as patients, we can psych ourselves up for these conversations. We're worried about them. But the anticipation is worse than the conversation. It does take bravery and it does take some energy to just say, I have to go have this conversation with my provider. But it could be the conversation that changes your life's trajectory in a very positive way. We just have to have it. You just have to, as my little 5-year-old nephew would say, you have to put on your bravery pants and go do it. You just got to go do it.
I think that, we as physicians need to be inviting to patients to just come in and have consults, right? So consult does not mean you're going to have surgery, right? A consult is a conversation. It's just to get information, right? And so I certainly don't operate on every patient that I see, right? It may not be the right fit for them. But I think it's important to go have that discussion, even if it is scary and anxiety provoking, because what you find on the internet is never going to be quite accurate, right? Because it doesn't take your health history and your journey and your operations into account. It's just general information. Whereas when you meet with a physician, they should be going through all that, right? They should know that about you. And so they tailor it to you. And at the end of that conversation, you may just say, nope, not ready or not for me. And that's okay.
Yes. Yep. And this is where being an active member of a community like BariNation can really come into play in your patient journey. Maybe you're not ready to have a conversation with your care team or with your bariatric surgical team, but in the back of your mind, something in you is saying a revision might be in my future. You can go to a safe place like BariNation. You can have these conversations in the support groups, in the classes, in the meetups. You can ask the experts. You can just voice like, I'm experiencing this. I don't know, maybe I need to go in, right, to have this conversation. BariNation is your safe place to kind of build up that bravery muscle and to get the encouragement and the love and the support from other people who understand what this journey is all about. The only thing that you're going to hear from people in BariNation is, wow, I'm sorry you're going through this. And then have you talked to your bariatric surgeon about that? That's what you're going to hear. And when you say back to them, no, I haven't, the response is going to be, can we help you think about the conversation? Can we talk through it with you? Like, use us as this place to practice having that conversation so that when you go in and do have it, you're a little bit, right? You're a little bit less worried, or maybe you're not so nervous. It really can be your safe place to practice. Which kind of leads into the next question that I want to ask. And Jason and Natalie, I would love to know, after Dr. Bagloo answers, do you remember the moment that voice in the back of your head said, you need to think about revision? That's what we need to know. Dr. Bagloo, how could patients know that maybe a revisional surgery is in their future?
Well, so let's start with like problem symptoms type things first, right? So if you're having trouble eating, right? If you're not able to maintain the diet that is recommended, right? So I tell patients that you should be able to tolerate most foods. I mean, there are going to be some things that you just can't eat after weight loss surgery, right? But most foods in small amounts, right? You should be able to eat. So if you find that you're vomiting, or you're having pain when you try to eat a solid meal, right? That's not normal after surgery. So that's certainly something to consider, right? Or if you find that you're taking antacids twice a day and popping, Tums throughout the course of the day, Well, that's not normal. Nobody wants to live that way, right? So first look for those signs, right? Because then you know something's off with the operations. Maybe, and it could be as simple as, okay, well, you're chewing too fast, or you're not chewing well enough. You're eating and drinking at the same time, right? And so it doesn't always mean you have to have surgery. We have to look and see what's causing those symptoms, right? But it could also mean that, okay, well, maybe there's an ulcer and we need to treat the ulcer. And that could just be done with medications. It doesn't always need an operation. Or it could be, well, no, the sleeve is causing that reflux. And so the only way to address this is to have a revisional operation. And then at that point, you decide if that's what you want to do, or no, I'm okay taking these medications. It controls the symptoms for me right now. Then you have to look and say, well, am I on a trajectory that I'm gaining weight kind of consistently? So over the last 3 months, have I seen weight gain? Over the last 6 months, am I seeing that I'm putting weight on, and I've looked at my habits and I'm doing everything that I'm supposed to be doing, and nope, it's not working just right? And then you might want to consider it for a weight regain issue, right? And again, I always tell patients, you don't want to wait until things have kind of like exploded, right? Because results are never going to be as good. So if you see that the trend is going in the wrong direction, come in. Right? So let's talk about it. Again, you don't have to choose to do anything at that point, but you're educating yourself about your options.
I think it's so important what you said. If you think something is off, go and connect with your surgeon. And a trend in a direction that you don't like seeing can be coupled with you doing everything right. I know, like Jason, that like the three of us have talked about this all the time. We talked about it also on another podcast episode. We truly can be doing everything right as a patient, but the disease is not responding in the way that we think it is. And that is our like ding, time to go connect with our bariatric surgeon. So Jason, do you remember the moment that you kind of like connected in your brain that, okay, a revision might be in my future?
It really was around the time that we were getting ready to go to retreat in San Antonio, because I realized that I was looking at pictures from the previous retreat, which was exactly a year before, and the changes in my body and my mental status and my comorbidities and the way I felt was monumentally different. And I realized that I was going to have to appear in public in front of these people that had seen me just a year ago, and I'm not going to look the same. There's noticeably different, because I had gotten down to about 285, 290 in that area with the sleeve. And then I had crept back up to 353. So it was a marked difference. So I knew that not only was I not going to, like, I was trying to find, I was pulling out stuff from the closet that I had from my way down. I was going back to the Big and Tall store and trying to buy things that were bigger. And it's funny how quick you can go back to old habits when it comes to clothes, thinking that just a half a size bigger shirt or, whatever is going to hide the fact that but it just makes you look bigger than you even are. If I just would have worn a shirt that fit, it would have been different. But at the same time, it just, the mental torture I put myself through during that time frame was just like, I wouldn't wish that on anybody. And as much as I tried to convince myself that it was never going to happen, that's about the time I really started thinking that it was probably, I needed to talk about it at least. Like, first steps first. If I'm going to do anything, I at least need to say the words to start making it real. Because it's one of those things, like, if you don't speak it, if you don't write it, if you don't, like, it's just going to stay rolling around in your head. And it wasn't until me and Nat had that conversation that I really kind of cemented the fact that it's something I needed to talk about more and kind of start really looking into.
Ms. Nat, what about you? Do you remember the moment on the first or the second that you?
So I had kind of two moments. The first one was from my lap band to the plication surgery. And that was unfortunately like an emergency situation. I wasn't eating, or I would eat and throw up. And it got to a point where I was experiencing like gastrointestinal pain. And my surgeon at the time was like, you need to go to the emergency room. So that was unfortunately an emergency situation. The second time around, from placation to VSG, I had a couple moments. 2017, 2018, I thought, man, I can't do this. I hit 350, which had been, was the weight that I was when I had my first surgery. And I thought, man, like something's got to give. So I went to, went through 2 rounds of jumping through the insurance hoops. And I got denied both times. And it was for my psych evaluation. I remember feeling so defeated because I thought, man, I'm really trying here, but I'm depressed. Duh. Of course I'm depressed. I'm, dealing with this bigger body. And this was before obesity was considered a disease. So that was the first moment where I was like, I'm trying, but apparently I'm supposed to just be big forever. So I gave up and I continued on with my life. I gained another 50 pounds, hit 403 pounds. And yeah, my grandma had passed away. Some people who have been listening to us for a while know this, but my grandma passed away and I wanted to live a long, healthy, happy life. And I realized I couldn't do that with where I was. And so, yeah, my mom was actually the one that was like, give it one more try. I found this surgeon. Here you go. Here's the information. And I thought, okay, like I'll give it the college try one more time. And I did. And I appreciate this conversation so much because it is very reminiscent of the conversation I had with my surgeon, because I had to tell him my whole story. I called him on the phone and he just said the words, "We can help you." And I remember just feeling like, oh, thank God. Like, I'm not a very religious person, but I was like, thank God you can help me. Thank God someone can help me. So that's what really got me to go through with it, was having my surgeon, someone that I had just met, say, I believe that we can help you. And this is why. And that's, like you said earlier, April, having the anticipation of the conversation was so much higher than what the actual conversation was. And having my surgeon act like a human and say, like, we can help you. Like, I'm sorry that all of that happened, but we can help you. And that's all it took.
I am so thankful that you shared that with us, Nat, because it's the next question that actually we want to ask. But Jason, I'm going to go to you first on this one, then to you, Dr. Bagloo. Nat, you just said you were so thankful that your surgeon said certain things, or that you really committed to exploring that. When we are thinking about having revisional surgery and we go back to our original surgeon, or we're looking for a new bariatric surgeon to bring into our care team, what are the things that we need to be looking for or asking? And Jason, I want to start with you here because you went to a different bariatric surgeon for your revision. What are the questions that you would hope other patients who are in this situation would ask a surgeon they're thinking about performing a revisional surgery with? Are there things that you want to make sure other patients know about?
Well, for me, it was just the knowing that there were other options. And I know now, like, Dr. Bagloo said, there's a plethora of options to choose from now with surgeries and technology and those things. And that was the biggest thing for me, is you don't feel like you're limited to only the menu of the closest surgeon. Like, I'm in Jacksonville, Florida. I flew to Dallas for my revision just because that's where I was comfortable with the doctor. We had a long conversation and I knew that's where I wanted to be. And so I flew down there to do it. I think it's one of the good things about how far we've come in, like, a lot of what Dr. Bagloo was saying really is amazing from the doctor's perspective, because so many patients feel like they can't ask the doctor questions because the doctor knows, the doctor's got the white coat. That's like when my original surgeon asked me, like, what procedure do you want? I was like, you got the white coat. I don't know. I left mine at home. Like, I don't know what I need. Like, you're supposed to tell me. Like, I have no idea. But, and that's the thing. I mean, it's people need to realize it's a dialogue between the two. It's an interview, not only, you for them, it's them for you as well, to see if it's something that's going to fit well with their program and what they can offer, but also for you. Like, if you don't feel like there's something that quite matches, it's okay to shop. And it's also okay to sit back with the information that you've got, that you've received, as well as the information you've given, and maybe kind of second guess the fact that you may have been a little prejudgmental and really hyped up on the anxiety of what was going on. And, a lot of people are like, well, I don't like, I'm not a big fan of the doctor's bedside manners, which you hear a lot of times. Well, what I had to be kind of coached into with my original bariatric surgeon is a lot of surgeons don't spend a lot of time talking to people. They spend a lot of time cutting on people. And that's, if they're good doing that, it can get you to the other side and off the table. That's okay. Like, that's why they have PAs. That's why they have an amazing nursing team. Like, they may not be, the next most talkative podcast host, and that's okay. As long as they can do the surgery they're there to perform and get you through to the other side with no complications or minimal complications, like, that's what we're going for. And I really am glad that we're trying to forward that conversation to people so that they can understand that it really is a dialogue that is two-sided. Like, you can ask questions and you can do a lot of research and come in with it. We've talked to plenty of surgeons that are like, we've had people come in with full notebooks and they ask away. And like, that's what it's for. Like, you had to take that time to do the research to come in with informed questions that you really want to know. And that's really what I wish I would have done more than anything the original time, was really done more research so that I would have more questions to ask. Because all I knew is I didn't want to feel like that anymore. I was told I was going to die, and I was 44 years old, and I didn't want to do that. So I was just like, whatever you got, like, give it to me and take it out. I don't care. Whatever you got to do, fix this, make it better. Like, let's go. Can I do it tomorrow? And, it really, I was fortunate enough to not have a very lengthy process to go through. It took about 4 months. So it wasn't like crazy as far as some of the people that I've heard that have had way lengthier ones, Nat being one of those people. But honestly, it really does. Like, I think going into it as informed as possible is really the only way to do it nowadays. Like, we have no excuse to come in uninformed because the information is legitimately everywhere.
Dr. Bagloo, what are things that patients need to be looking for and asking when they are interviewing a surgeon?
Yeah. So I think you want to look for a surgeon who is, one, willing to accept that obesity is a disease process, because even some surgeons still don't really look at it that way, right? But I think the data that has come out really speaks against anyone that is a naysayer to that, right? And someone that is willing to help you and is partnering with you, right? So it's not like you're convincing them that they need to do this for you, right? That they are a proponent and an advocate for you, because that's what you want, right? And then you want someone, there's a lot of people that can do different bariatric operations, right? But some people feel only comfortable doing a band or a sleeve, right? That's not your revisional surgeon, because they don't have the experience to do that. And they stay away from it for a reason, right? So you want someone that is armed with the ability to do all of the bariatric operations, right? So that's an important key point, I think. And whenever you're doing a revision, right, you want to make sure that there are resources available so that if there is a complication, your doctor has access, right, to other resources that are going to help you. So I think that's important, so where you go, if it's somewhere that's kind of isolated, that doesn't have a lot of extra resources, if anything happens, they may need to send you to someone else, right? I personally don't like to send my patients away. If you're my patient, you are like family to me. you are my patient. I'm going to help you. We're getting through this no matter what, right? I'm not bailing, right? And so for me, that's important. I want something like Advent Health, where I have, gastrointestinal colleagues that can do advanced procedures. I have partners who, if we have a difficult case, we're going to come running in to be like, okay, let's have as many surgeons involved as we need, right? So I think those resources, especially for revisions, are important because revisions are, technically more challenging, right? And so that is something that, first time around may not be as important, right? Because the anatomy isn't altered. But once you start going down that other road, I think that experience, those resources, that expertise is really important.
I very much appreciate you calling that out, right? Because it could be challenging to find a local surgeon that maybe can perform all of the surgeries that are available. There are some very technical ones that require massive machines and robots to really be able to perform well. But if you go to a place like Advent Health Central Florida, where you have a massive team of not only skilled bariatric surgeons, but nurses and specialists and campuses where all of the support is there for any eventual possibility, you know that you are going to get the best care possible. And we are allowed to shop around, to check out places like Advent Health Central Florida, to really explore all of the services that they offer. That wraparound care could be beneficial. Not that we hope or we think that you might need more care above and beyond that. But if the moment arises, you need a team that can rise with you in those moments. So yeah, phenomenal. The last question that we have for you, Dr. Bagloo, is about insurance. Are revisional surgeries covered by insurance?
Absolutely. Yeah. So, and there's different pathways that you take, right? And so, like, for example, reflux, I keep going back to this because it's common. Reflux is a known, I call it a side effect, right? Complication, side effect. We know that about 20% of patients who have a sleeve are going to have de novo or like new onset reflux, right? And so that has been shown and recognized. And so a lot of insurances will now approve a revision even if you don't meet BMI criteria, right? Because you're not doing it for weight regain. You're doing it to address that you're having reflux secondary to this procedure, right? And so you may need to do things like an endoscopy or an upper GI series. And we need to show that, yes, this is affecting your daily life. You're taking medication. You may have some esophageal changes because of it, right? So that's one way that you can get a revision approved. If there is a technical problem with the operation, you have a stricture, a narrowing that's causing you to have vomiting, right? Well, that's another reason that we could get insurance to cover it. If it's because of weight regain, right, that too is covered. But you have to do all the same stuff that you had to do the first time around, and you have to do a psych eval and go through the whole kind of prep period, which I don't think is always a bad thing, right? Because you're kind of resetting everything. You're starting over again. You want to get that information about, like, okay, so what do we do with the diet again? And, the second time around, you're still going to it's the same thing. It's like you had it all over again. So you start with liquids, and you go to mushy, right? To purees and then soft solids. And if you did that 5-10 years ago, you're not going to remember those details, right? So that refresher, that information, that nutritional component of things, I think is an asset.
Absolutely. And I know Natalie is going to speak to this, and I'm going to hand the mic over to her, because the kind of the last question that we want to have everybody answer is, what do you wish is the one thing that people really knew and understood about revisions? Or what's the one thing that, like, for Jason and Natalie, you hope other patients kind of carry forward with this? And I know that, Nat, you really want to speak to that whole newness concept. The other thing that I just want to leave here with this conversation about insurance is that don't be discouraged if insurance is being difficult, or if for some reason it is denied. Like, Natalie, I know your second revision was self-pay. Advent Health Central Florida offers self-pay opportunities and options, and they might not be as crazy expensive as what you think. I was floored when I heard some of the initial rates that Advent Health Central Florida offers. So absolutely explore all of those avenues. Self-pay could be something that is accessible to you, and you just have to have that conversation with your providers. So yeah, to kind of wrap up this conversation, I would love to ask all of you, what is kind of the one thing that you wish patients knew or that they're leaving this conversation with? And Jason, we'll start with you, then Nat, and then Dr. Bagloo.
For me, probably the biggest thing is just don't make the mistake that I did where you sit in shame for the length of time that I did and tell yourself that you don't deserve revision, that you don't deserve the help that's out there for you, that you have failed, that you've messed all of this up. You had one shot and you blew it. All these things I told myself because we are world heavyweight champions at beating ourselves up when it comes to any adversity. We're the first ones that are going to be the hardest on ourselves. And, what I had to remember was, as I was told to by my surgeon who performed my revision is, when he listened to me explain to him what I was thinking in my head, he's like, would you say that to anyone else? And I was like, God, no, absolutely not. I would never. And he's like, well, then why does it make sense to say it to yourself? And I was like, well, I guess it doesn't technically because I would say a good 9.5, almost 10 months, I sat and told myself these things as I watched the scale creep and creep and creep and creep. And I was doing the things, was I perfect? Absolutely not, because none of us are. But at the same time, like the rate that I was regaining was not due to the things that I was or wasn't doing. So without, the full breakdown of realizing that it is the chronic disease that I am fighting, which means it is going to remorph, it is going to get smarter, it is going to kind of, it's going to try to tackle all the treatments I've been giving it, and I'm going to have to find other ways to add adjunct treatment to it. And I wasn't listening to myself. Like April said, I wasn't listening to them. They were, and it just, I internalized it so much. There were things I wasn't telling my family, like I wasn't telling anybody. And, and I don't know if to myself, I felt like I was hiding it. If I just didn't talk about it, like nobody had eyes and could see what was happening. I just don't, I don't want anyone else to sit in that shame. And that's why the second that I decided to reverse my decision, I started shouting it from the rooftops that everybody needed to know that it wasn't something to be shamed about or for. And the stigma around it does need to go away, because it wasn't shortly after I had my revision that somebody on one of the social media platforms on a live was like, well, nobody has revision unless it's medically necessary. And I was like, oh, but I beg to differ. Like, that's not true. And you can't be, I mean, you can say whatever you want, but it doesn't make it true. Like, that's why it is so important for people to, really pay attention to what it is they're listening to and the information they're taking in, because if it's not from an actual trusted source, like, could be a little sketchy. So that's why research is very important. But yeah, please just do not sit in shame. Please contact your surgical team, contact a friend, reach out to somebody that can support you in that time, because sitting in it doesn't do anything, but it just adds to the time you could have been doing something to make it better the whole time. Because I can tell you now, I feel even better now than I did when I had my sleeve and was at my lowest weight then. I'm smaller now than I was then. So all the comorbidities are gone, all the things that were creeping back in, all the things that never left. Like I'm living proof that it can get 100% better. So just don't wait.
Everything that Jason said is spot on. Don't wait. Don't sit in that shame. I think for me, it is treat your revision like the first time. I know Dr. Bagloo, you were alluding to that, things change, the medical world changes, the guidelines have changed. That was something that I did pretty much every time I had surgery, all 3 times. I just said, okay, I am the student. I may have had experiences in the past that are relevant now. But in a way, it's also not. VSG is vastly different than the lap band. And I can treat it a lot differently than the lap band or plication. And I think just really taking a step back and saying, okay, I have some experiences. These are really valuable. And I'm going to sit and be the student and treat this like the first time. And that really helped me, especially with my VSG surgery, just absorbing the new information, the new guidelines, and treating it like my first time. it was a huge lesson for me to kind of be that first time student again. No one likes to be the first time student. No one likes to think they don't know things. At the same time, I don't know what VSG life is like. So I'm going to act like the first time student. But that's my main piece of advice is if you are looking for a revisional surgery, treat it like the first time. Ask all the same questions you did before. Have those hard conversations with your provider, and quiz them. Like everyone said earlier, quiz your providers. They're there to help you. And that's something I wish I knew the first time around.
From my perspective, like you're partnering with your doctor, right? You guys are a team. The doctor is not what it used to be, when they knew everything and that's everything they said was, there's no changes. You have to work together to find what fits best for your lifestyle, right? So I think that's an important fit that you want to find. And you're not limited to just who you can drive to, because in today's day and age, right, we do virtual appointments. And I can work with your primary care doctor in any location, right? So it's not something that you should limit yourself to. I think that fit and that team that's going to be behind you is really very important. So look for that when you're going through this, whether it's the first time, the second time, or the third time, right? Because that's the team that's going to be rooting you on. That's the team that's rallying for you, right? So that's a big part of this. And then just make sure that the surgeon that you choose is experienced with all the types of bariatric operations, and has the resources available to be able to help you. And you can't go wrong. This is not a failure. Right? This is progression of a disease and it needs continued treatment, right? And once we can get this to be, what everybody knows to be true and release that stigma, right? Then these conversations will seem historical, which is what I look forward to, right? Because we as physicians, not just as bariatric surgeons, but as physicians as a whole, we are here to help our patients. When we graduated, when we took that Hippocratic oath, many years ago for many of us, right? That's what we said we were going to do, right? And we can't forget that. And it doesn't matter what the disease is. So obesity isn't unfortunately going anywhere, right? And so really look for that team, look for the doctor that fits, with you. If you'd like to come see us, any one of the bariatric surgeons in Advent, we can all make it happen, even if you're across the country. So don't let that be a barrier. We would love to see you.
Dr. Bagloo, I could not think of a better way to wrap up this conversation. What a phenomenal opportunity to tap into your expertise and really help so many people around the nation and around the world start to understand, just like what you said, obesity is a lifelong and chronic disease and more treatment might be needed and necessary. And I know I speak for Jason and Natalie when I say this. It is so inspiring and hopeful for us as patients to have these conversations with professionals like you, because you are embodying what we hope everyone's experience is along their bariatric journey, that they can connect with a deeply skilled professional, somebody that understands that this disease is with us for the rest of our lives, and somebody that wants to partner with us to help us access all the treatment that we need. You are phenomenal, and we so appreciate your time and expertise.
Thank you so much.
If you would like to connect with Dr. Bagloo, the links to the Advent Health Central Florida website is down below in the show notes. All you need to do is just go down there, scroll. It will take you to their bariatric centered web portal. You can book a consultation. You can learn more about their services. It's a phenomenal opportunity and place for you to continue to treat your disease of obesity, even if you don't live in the Central Florida area. So absolutely check them out. Dr. Bagloo, thank you once again for joining us today. We appreciate you.
Thank you so much for having me.
We are so thankful for our partnership with Advent Health Central Florida. It means that we can extend discounted monthly membership rates to their patients. If you are a patient of Advent Health Central Florida, reach out to your provider so that you can access the amazing support groups, classes, and meetups that are happening each and every week in BariNation. If you're just starting your bariatric journey, activate that membership and attend our Bariatric Beginning support group that's hosted by Laura Grabo, or our Bariatric Beginning meetup that are hosted by Natalie Tierney and Herb Lentz. These happen each and every week. And if you're a little bit further along in your journey, maybe you're in the maintenance stage, again, activate your membership and attend Life and Maintenance Support Group hosted by Laura Graybo or our Addiction Transfer Support Group hosted by Sarah Smith. No matter where you are in your bariatric journey, we have support that's meaningful for you. Call your Advent Health Central Florida provider today and access your discounted monthly membership. We can't wait to see you in the nation soon. That wraps up another empowering episode of the BariNation podcast. If you enjoyed today's episode, keep the conversation going by joining the BariNation membership community, where you can attend live support events, access on-demand resources, and find a caring community.
Join us at barination.mn.co. If you found this podcast valuable, help us produce it by becoming a $5 monthly supporter at barinationpodcast.com.
And just remember, at the end of the day, you've got this, we've got you, and we'll see you next time. Bye, everybody.